Welcome. I'm Dr. Jessica Israel. I'm the Senior Vice President of Geriatrics and Palliative Care at RWJBarnabas Health and the Corporate Chair of the James and Sharon Maida Geriatrics Institute here at RWJBarnabas Health. I am super excited to welcome all of you today to our webinar. We're expecting 1,000 viewers to be on the line to learn about what is going to be very important and practical information. I'm joined here by the three physicians that are part of the newest James and Sharon Maida Geriatrics Institute here at St. Barnabas in Livingston. Dr. Manisha Grover, who's now on my left, Dr. Theresa Redling, and Dr. Emily Bahler. So before we begin, I'm going to welcome Steve Zenowitz, the CEO and President of St. Barnabas Medical Center, for a short welcome message, and then we'll get to the meat of our discussion.
Hello, I'm Steve Zenowitz, President and Chief Executive Officer at St. Barnabas Medical Center. Welcome. Today we celebrate the grand opening of the James and Sharon Maida Geriatric Institute at St. Barnabas Medical Center. We want to thank the visionary leadership of James and Sharon Maida and their generosity to RWJBarnabas Health that has enabled St. Barnabas Medical Center to open this interdisciplinary geriatric institute at our ambulatory care center in Livingston, New Jersey. Tonight you will learn a lot about the innovation of this institute and how it will provide and coordinate services for our seniors, including home visits, taking care of patients in the office, or if a patient is in the hospital, providing inpatient care. Tonight's program will be educational and provide you important information that will keep you healthy.
So welcome again to we're expecting 1,000 viewers, which is amazing, and we are super excited to have you together. Let's move to the next slide so that we can talk a little bit about what we're going to do today. So we posed questions to all of you via email, asking you to send us what your questions were about COVID and about what it means that the state is reopening. Our presentation today, we didn't know it when we planned it, but is really timely because of the changes that are happening. Even as soon as today, there were a lot of changes in the stay-at-home order and in new things being open. So we got a lot of questions. We tried to anticipate questions ahead of time, and thankfully we anticipated a good amount of them, but then there were some extra things that made us think a little bit too. So I just want to say up front a couple of disclaimers. One is, I wish that we could get to every question that was asked, but we're going to do our best, but we certainly won't hit all of them. But we're going to give it a good shot. And then I also want to say, when we think about the answers to these questions, it's important to recognize that in some cases, there is no perfect answer, and there is no one single answer. You have to think of, from a common sense perspective, which we're going to try to provide, a guideline-based perspective, which we're going to base our answers on, and then also an individual perspective. The same question in two people really has different implications depending upon what surrounds that question. And we're going to talk a little bit more about that as we get into details about the questions moving forward. We're going to talk today about COVID. We're going to teach you a lot about what it means in this era, kind of after or during the reemerging. And then we're going to talk a little bit about geriatrics too, so you get a chance to learn something that you didn't realize you were going to learn today as well. So we'll move to the next slide. Just kind of lay out the expectation for the presentation. So in the beginning, the first part we're going to focus on is the community surrounding us. What do we need to know to be safe in our homes, in our communities, and with our friends and neighbors? In the second section, we're going to talk more about the healthcare community. What if I get sick? What if I need to go to the hospital or the emergency room or the doctor's office? How will I know that that's safe? And what are some of the changes specifically around that setting? And at the end, we're going to talk about geriatrics and how COVID is different in older adults, how it presents differently than you might expect. So really 3 sections, and then we took your questions and we peppered them into each section in places where we thought that they fit. So again, thank you for joining us, and let's get started. I'm really, really excited to introduce our first presenter today, Dr. Manisha Grover. I'm going to tell you a little bit about each of our physician presenters before they go ahead and dive into the material that they're going to be talking about. So Dr. Grover went to GR Medical College in India for her medical degree, and she did an internal medicine residency at NYU Downtown Hospital in New York City. She did a fellowship at Maimonides Medical Center in Brooklyn, New York in geriatric medicine. During her training, she's received awards and recognition, including a gold medal for her performance and recognition as her training program's best ambulatory care resident, which I think prepared her well for the amazing doctor that she is now in outpatient and other arenas. She worked as a hospitalist for 8 years before joining the current geriatrics practice. She spends most of her time in the office, the hospital, and in assisted livings. She loves to teach, and she's involved in the education of the residents at St. Barnabas Medical Center in both medicine and geriatrics. She runs the caregiver support group for families with patients that have dementia, and she's clinically interested in advanced care planning, dementia, delirium, Parkinson's disease, falls, end-of-life care, and hospital medicine. So, without any further ado.
Thank you so much for the glowing introduction. Welcome, everyone, and thank you for joining us for not just the opening of the Geriatric Institute, but also for this discussion on COVID. The pandemic is something which is without precedence in our lifetimes, in fact, without precedence in the last 100 years. There are a lot of changes. The number of cases in the state and over in the country is starting to go down. Last week, we were talking about how doctors' offices are now seeing more patients in person. Dentist offices are opening up, and restaurants are preparing to open up for outdoor dining. There are many changes coming, and today the stay-at-home order was lifted. So the big question in everybody's minds is, what does this mean for us? How do our lives change? What can we do? But more importantly, how do we continue to protect the vulnerable sections of our society, our seniors, people who have medical problems? Because the virus hasn't yet gone away. We do not yet have a viable vaccine that is available to us. So it's important to use a mix of guidelines, common sense. Of course, personal priorities and personal preferences play a very big role in how we approach our day-to-day interactions. The social isolation has been an extremely important aspect of reducing transmission of COVID and also keeping us safe. However, picture to yourself an older lady who lives with a companion, has a large family. Her major pleasure is having family over for lunch, grandchildren or children almost every other day. During the 2 months of the pandemic that have passed, her behavior suddenly started to change. The companion made frenzied calls to the physician and the family. She was concerned that she was being given the wrong food, somebody blocked her belly, and all sorts of things which were extremely distressing to her. After careful deliberation, the family and the patient's physician decided together she needed to get her family back into the house. And they trooped in with masks, her favorite foods, and all sorts of stories. They kept their distance. She was taken out around the neighborhood to wave to neighbors. She was taken out in a car with a mask. And over a period of a week, the result was more miraculous than any amount of medication could have achieved. Human beings are social beings, and therefore it is very important for us to be integrated into the social fabric. Depression and anxiety are just 2 examples of diseases or conditions that can arise or become worse during isolation. However, other chronic illnesses, hypertension, heart disease, are also affected by our social situation. People who are isolated are less likely to have physical activity, and a sedentary lifestyle leads to its own complications. So moving forward, as we move out of social isolation, there is the question of keeping our seniors, our oldest of the old, the frail nonagenarians, centenarians, we have a few of those, and also our younger seniors who live very full lives, running around, taking care of grandchildren and supporting their families in innumerable ways.
So it's a great example of what can happen when someone doesn't have social contact, because it's so important and integral in our lives, and it's been so incredibly difficult for people not to have that. And I think that's why there's a lot of questions about when and how can we get back together. So can you comment on a couple of these viewer questions? So the first one is, my family member had COVID and has antibodies. Is it safe for them to visit me?
So information about COVID is continuing to accumulate. The question of the antibodies is also which kind of antibody does the person have? And beyond the scope of this conversation, of course, is the sensitivity of the test. However, the antibody that we want to see is IgG, which indicates to us that someone is recovering from an illness. Having the antibody does not necessarily mean that the person is not still shedding the virus, and hence wearing a mask, keeping social distancing is still important, not just for the protection of people who come in contact with the person, but also for the person themselves, because we do not know if people can get reinfected with COVID.
Mm-hmm. So that was another reader question. If I have the antibodies, does this make me safe? Does it make me less likely to contract the illness?
Possibly, however, the information on that is still accumulating. We do not have a definite answer on whether or not we can get reinfected with COVID. Hope springs eternal. We do use the plasma from recovered patients to try to treat those with severe disease.
Mm-hmm. It's hard. It just illustrates the point that in a lot of circumstances, it's hard to answer exactly because there's still so much that we don't know. And when you're talking about the COVID and antibodies, really what you're saying is we need more information from you to answer that question. There's a lot that surrounds that. How about this question? I have a family member who had the illness. How long do I have to wait for them to visit me?
There are simple clinical guidelines to guide us. Someone who is more than 7 days from the onset of symptoms and is 3 days from complete resolution of symptoms without use of any acetaminophen to bring down fevers is now safe to go out into the community. However, alluding to the previous questions, we still do not know if the person is shedding the virus. We don't retest people. So it is important to continue to mask, distance, wash hands.
Mm-hmm. Great. So let's move into the next slide. Just in with what you just said, let's lay out what the guidelines are. How can you go through that for us?
So the guidelines have hand washing, distancing, and masking at the center of everything that we want to do to reduce the transmission. Apart from that, commonly used surfaces, commonly touched surfaces should be frequently cleaned so that fomites or inanimate objects with the virus on them are not spreading infection. It is also very important to have cross ventilation if possible. However, the most important things still remain: avoiding crowds, doing what we can do from home, still continue to do from home, keep vulnerable people isolated. Most important, always remember to wash your hands. If possible, wash your face, because it can be very inadvertent to touch your face. Use a mask, a good mask. Surgical loop masks are excellent, well-made, home cloth masks are good as well. When you do have to meet people, continue to maintain your distance. The question also is, can we meet our extended family? Can we meet at home? And ideally, small gatherings, meeting in the yard, on the deck is easier because it's easy to maintain distance. The question also becomes on who we can include in these gatherings, and it's safer to include older children, not toddlers, because they're unable to maintain social distancing.
Mm-hmm. So a couple more viewer questions that have to do with the common sense approach to these guidelines. One of the questions is, my children are going back to work in New York City. Is it safe for me to stay with them?
So every family has its own priorities and personal preferences. Obviously, every family is different. We do not know what their situation is, how the family functions. It is important to keep the frail or vulnerable people protected, and distancing within the house or even masking may be appropriate. More important, the onus is on the people traveling out into the city to keep their distance, wash their hands, and minimize the chances of transmitting something from outside the home. Even during the pandemic, many families, because of personal preferences, have continued to have grandparents care for grandchildren because they still needed to go to work wherever they did. And in the setting of a family member who was ill and delirious, people have disregarded the guidelines of masking and distancing because in that moment, it was the right thing for them to do, to hold their family member and help them.
Right. I think it illustrates that every situation is different, and that some of these questions you really have to take on a case-by-case basis. The point that the family member that's driving into New York City, maybe they're not taking public transportation, maybe they're driving, maybe they're wearing a mask, maybe they're working in an office without contact with other people. Like, there are a lot of things I think that go into that advice. So they're really good points that you bring up. How about, do you still need to social distance if you're wearing a mask?
Nothing is perfect, and wearing a mask is an excellent thing. However, keeping distance is also helpful because a mask may not be perfect. People are not always cautious about keeping the mask over their nose because of the weather, excitement, and many other factors.
Can you comment about if there is an inside visit, say a family does visit a grandparent in the home? What about sharing food or using the same bathroom? Any advice about that?
An inside visit does require more planning because we don't really have cross ventilation. There are areas which are touched frequently. There are things which are used and may be common. So ideally, plan the visit. Keep it to a smaller gathering. Keep it to people who will be responsible. It is important to clean and wipe down commonly used areas before, during, and after the gathering. Restrooms have to be cleaned out after every single person uses them. If it's a house where there are windows, it would be great to have cross ventilation, and if the weather, of course, allows. Food is something that we are still struggling with because ideally we would not like people to share cutlery or to gather over a dish, which is one of the pleasures of getting together as a family. So ideally having individual portions or even bringing your own food and your own beverages is a good idea. However, families are going to be answering this question in the future and sharing their ideas of how to maintain distance and reduce transmission of illness, if that were to be the case, if there were asymptomatic people amongst the gathering.
Mm-hmm. It's great information. So as we move into the last part of your section here, a lot of older adults commonly use home care services. We can move to that next slide. The next one. Okay. So a lot of older adults use home care services. So those. And some of them are nervous about having physical therapy resume at home or having home nursing come into the home. can you talk a little bit about that? Is it safe to have people come into your home?
There are many services that are provided in the homes. Physical therapists and occupational therapists help people recover from illnesses, get back their strength. Many of them play a very integral role in keeping people active. Apart from physical and occupational therapists, there are also palliative care nurse practitioners and hospice professionals, nurses, social workers, clergy who go into the houses. Many people have tried to work remotely with family members. However, through the pandemic, the Visiting Nurse Association, which is part of Barnabas Health, has continued to provide services in the home. Therapists have been fully protected with PPE and have taken whatever possible precautions they could to protect our patients, especially our vulnerable seniors. Prior to the pandemic, we had services such as lab draws and x-rays, which went into the home for our homebound elderly, and they have proved to be a boon during this pandemic, helping us to get these services where they were most needed. It is safe when people coming into the house are taking precautions. It's important to make inquiries about the professionals who are going to be coming into your house. Nothing is perfect, so we should also take precautions on our part, wearing a mask, wiping down common surfaces after the visit.
It's great information and important that people don't put their healthcare needs on hold because they're worried about having someone in the house. Especially in the circumstance, I think of physical therapy, how important it is to get up and to move and to have that kind of help. But without it, for long periods of time, can really be tough. So thank you so much for that practical information based on our guidelines. I think it's really, really helpful. And we're going to move now into the next section of our presentation. And I'm really excited to introduce the newest member of our geriatrics family here at St. Barnabas, Dr. Emily Bahler, who received her medical degree from the New York College of Osteopathic Medicine, doing an internal medicine residency at Maimonides Medical Center and a geriatrics fellowship at Maimonides Medical Center. Before coming to join us at the Maida Institute at Barnabas, Dr. Bahler specialized primarily in outpatient geriatrics and also spent time in nursing homes and assisted livings. She now supports the physician team here with inpatient and assisted living care, as well as teaching the medical residents at St. Barnabas. She's a member of the American Medical Association, the American College of Physicians, and the American Geriatric Society. And her clinical interests include dementia and cognitive loss, as well as depression and mood disorders in older adults. Dr. Bahler?
Hi, how's everyone doing today? So I'm going to talk about, is it safe to go to the hospital, emergency room, or doctor's office, and what is the time to really come in for a checkup? So what if I get sick? Is it safe to go to the hospital? Yes, it is safe. The hospital has excellent procedures. So if you're experiencing a life-threatening emergency, by all means, go. We are here to help you. Upon entering the emergency room, trained staff are there to greet you. They will take your temperature and ask symptom screening questions. Have you had a temperature? Do you have shortness of breath, cough, sore throat, loss of taste or smell? These are just a few of the questions to help guide you to the appropriate location. Teams who greet you will be wearing personal protective equipment, PPE as we call it. This includes gowns, face shields, face masks, and gloves. You will be safe. And we also need to realize the peak has passed. The hospitals are reopening and elective surgeries have begun. Every patient admitted from the emergency room to the medical floors will also be tested for COVID. So just to reiterate, if you're having a life-threatening emergency, go to the hospital. This is where we, as geriatricians, step in. We are a team of board-certified physicians who realize the diseases and disabilities of the elderly community. We're there to listen, treat, discuss with your family, and help you maintain your function and independence. Our goal is to work with you and your family to help coordinate care while maintaining physical and cognitive function. From the emergency room to home, we will be there every step of the way. Yes, home. Expect to hear from us with a transition of care call. We want to make sure you get home safe and understand the present discharge orders, review any medications, and answer any questions you may have. Our goal is to make sure all geriatric needs are addressed. Is it safe to come to the office? Yes, please come to the office. Our doors are open and we've missed you. All safety precautions are in place. With a quick call from the car, you will be evaluated with a temperature check and a symptom screen, and then directed into an exam room. There is no need to wait in the waiting room. Once in the room, you will quickly see us. We do understand that an office visit may still be overwhelming. That's okay, because we are also very active in our telehealth visits. We want you to do what's most comfortable for you. Whether in the office or home, ask us about a Medicare annual wellness visit. This is where we discuss your medical history, medications, social habits. We talk about your present list of providers, preventative services, ask questions about depression, cognitive loss, advanced directives. Our goal is to help you prevent future illness. Prevention prevents hospitalization. But certain illnesses and chronic conditions are best checked in person, so we need to consider all our choices. Hopefully, we soon too will be able to return to our assisted living facilities. We miss them too.
So as we talk about opening up and what that means, we have some questions from the viewers.
Sure.
This is probably one of the most common burning questions. Can I get a haircut?
The answer is yes. I am already on my wait list for mine. So we just have to make smart decisions. Yes, you need to ask questions. What type of precautions is the salon doing? How far apart are the salon chairs? Is the salon properly ventilated? And again, always wear a mask.
What about eating at a restaurant where New Jersey's starting to open up slowly from delivery into some in-person dining? What do you think about that?
So I'm going to say no indoor eating yet. It's just still too risky to be in such close proximity to other people, just not yet at this time. Outdoor eating, though, is a possibility, but make sure masks are kept on when any waiter staff is close. 6 feet distance is kept. Do not unmask unless eating, and only a mask around your household family.
It's great advice. Thank you. So when you talk about chronic illnesses, we'll move to the next slide here. We've been doing a lot of telehealth and reaching out to patients at home via telephone, but life still continues and there are things that need in-person visits. Can you give us some advice on what really needs to be seen hands-on in the office and what maybe could wait?
Right. So we really enjoy seeing patients in the office. So I'm going to start off by saying that we'd love everyone to come in. But most disease states do benefit from a good physical exam. These include coronary disease, possibly due for an EKG or some blood work, cancer screening. Are you up to date on your health maintenance testing? Chronic lung disease. Has there been a decline in your baseline breathing with some deconditioned state with the quarantine? Stroke or ischemic workup. Let's talk about your risk factors. Cognitive loss. Is your family or you noting changes in your memory and your function? Diabetes. Our diets haven't been the best. Let's get you in for a workup and discuss that. Or lastly, chronic kidney disease. Our hydration status at times is not the best. We can monitor that, keep you on track with your diet, and discuss any certain medication changes that need to be done. We as geriatricians are here as a community to help you and do the best we can do for you.
It's a great answer. A lot of people had questions about this, and I think that the overriding lesson is, life goes on and health continues, and it's really important not to pay. It's important to pay attention to your health problems. You don't want to put everything on hold forever because there are a lot of things that we can do in the office that can help prevent change and help you to improve. So, thanks for answering that. So let's move on to the last part of our presentation, and I am really excited and honored to introduce my colleague and my friend, Dr. Theresa Redling. She is the medical director of the James and Sharon Maida Geriatrics Institute at St. Barnabas Medical Center, and she's board certified in geriatrics, internal medicine, and hospice and palliative care. She received her medical degree from the UMDNJ School of Osteopathic Medicine and did her internship and residency at Morristown Memorial Hospital here in New Jersey, and a fellowship in geriatrics at the Mount Sinai School of Medicine, now the ICANN School of Medicine in New York City. She joined St. Barnabas Medical Center in 2012 after holding geriatric chief positions at Beth Israel Medical Center in New York and Newark Beth Israel here in New Jersey. She has a primary care and consultative practice at the Institute and manages her own patients with her team of geriatricians if they require hospitalization at Barnabas. In addition, she provides consultative care at St. Barnabas Medical Center for hospitalized elders, assisting other physicians in best practice for hospital-based elder care. She teaches physicians in training, medical students, and many other healthcare providers the art of geriatric medicine. Her clinical interests include caring for complex elders, diagnosis and treatment, including new drug trials for Alzheimer's disease and related dementias, as well as promoting, teaching, and improving the care for health system elders. Dr. Redling is the recipient of numerous awards, including New Jersey Top Docs and a Castle Connolly Top Doctors for multiple years, as well as many community awards for best practice in geriatric medicine. So Dr. Redling.
Good evening, everyone. Thank you for joining us for this very informative and I hope enjoyable evening. So you can move on.
Next slide.
So,
That's what happens when you do things
there we
live.
go.
Backwards.
Sorry about that. There we
right
go.
There. And one more.
Okay. There. Okay.
This is what live television is like. Okay.
So this is one of my favorite slides. Actually, my daughter helped me make this one. So I'm a geriatrician. What's your superpower? This really describes what we epitomize in geriatric health. We are a subspecialty group of either family doctors or internists that have additional training after we take our training in a fellowship in geriatric medicine to take care of complex older adults. So we do see people over 65. The vast majority of the people we see are really in their late 80s, 85 and above. And as Dr. Grover pointed out, some of our centenarians, we take care of quite a few people that remain independent into their hundreds. So geriatric care is definitely a specialty. We do the vast majority is primary care for older complex adults.
This is also my favorite slide. So while we're here, I think it's important to point out, and I said this in the beginning of the presentation, that a lot of illnesses and diseases present differently in older adults, and COVID is no exception to that rule. Can you talk a little bit about how COVID-19 presents differently as we age in ways that maybe we wouldn't expect?
Sure. So most older adults have what we call atypical presentations for common illnesses. For example, if you're having a heart attack, you may not have chest pain like a younger individual would. You may just feel a little short breath or just tired. Heart failure may present the same way, and COVID is no different. So COVID, where commonly people have a fever and a cough, often in our population, they don't have a fever, and they may not present with the respiratory symptoms until much later in the disease or until they're very, very ill. So maybe actually very subtle things like poor appetite or fatigue, kind of a failure to thrive, I got the dwindles type thing. So it can be actually very confusing. And we also have to take into consideration the other medical problems the individual has. So it can be challenging sometimes to diagnose it.
You have to think about all the possibilities, especially when so many things can present differently. So it's something for our viewers to think about with people that they love at home, that just because someone doesn't present with the symptoms that we commonly associated with COVID doesn't mean that that's not what they have.
And the point also that just because you're sick doesn't mean you have COVID.
Great point.
That other people continue to have other medical issues. It may be an exacerbation of your underlying heart disease or heart failure or an emphysema exacerbation. Not everything is COVID, although that's certainly on everyone's mind nowadays.
It's a really good point. So we'll move to the next slide.
So what is an age-friendly healthcare system? We like to pride ourselves here at St. Barnabas on developing one, which is a continuity of care and optimizing care for older adults, which really takes a village or an interdisciplinary team approach. So these are the 4 M's of geriatrics. And the first one is what matters. And we really look at your individual goals of care so that we can align what we think is appropriate for you with what your goals are for your health. Mobility is another thing that we assess and look very closely at functional status. So one of the things we do frequently is assess your functional status. We know that falls are could be disastrous for older adults, and maintaining mobility maintains independence, improves quality of life. So we look at that very closely. Medication review and management is another big area that we really have expert skills in. So I would say most people over 65 are on 3 or more medications, and as we get older and have multiple chronic medical conditions that overlap, some people are on 10, 12 or more medications, which could be appropriate. However, we have to review frequently, reconciling meds. Our needs change, we metabolize drugs differently, our physiology changes. So is this drug still appropriate for you at age 92? That's something that was started when you were 45. We have to look at how drugs interact with each other and how drugs interact with you. So frequently we take drugs away. We what's called deprescribe when it's appropriate. We also look at your outpatient meds because even though it's over the counter, it may not be safe for you. There's quite a few drugs that you can find and buy in your pharmacy that are not appropriate for older adults. And we frequently will say, if you start a med, try to take one away because they accumulate. So medication reconciliation review is common and something we do a good job with. And then mentation is the 4th M on the slide. Over 50% of people over the age of 85 have some type of cognitive impairment. So it may be short-term memory or it may be something more severe where we actually call that a dementing illness. We need to evaluate you, look at your medications. Are they appropriate? Are they contributing to cognitive impairment? Or do you have vitamin deficiency? So some things that are potentially reversible, we look very closely at, and we do a really good job identifying and appropriately treating. If you do have a cognitive disorder that may be a dementing illness like Alzheimer's or something related, then we're there as well to help you navigate that with your caregivers. So cognitive assessment is important. And then the last M, which is not on the slide, is multiple and complex. That really is our area of specialty and expertise. We manage people with multiple chronic medical conditions, and we identify those issues that are acute, how they interplay with chronic conditions, and we do an excellent job managing complex issues with seniors.
That's great. Just dovetailing off this slide, when we talk about what matters, I have a couple more viewer questions. So here's what matters to our viewers on this call. When can I hug my grandchildren?
Right. This is a really hot topic, and you have to really watch when you go online. Like, you have to look at your source. So we're using guidelines specifically that have been developed, and this is an evolving field. So the answer probably is no at this point. You have to use common judgment. If you are going to hug, then you try to do with masks, no face-to-face, no direct face-to-face, no cheek-to-cheek. I mean, that's how it's transmitted. You have to use the proper hygiene. If you are going to do visits, social distancing is appropriate. And very young children, you may really want to be concerned about because they don't understand social distancing. So the answer is probably no, but you really need to use your own best judgment and use certain guidelines to make that decision.
It's another one of those circumstances where it depends on the person that you're hugging. Have they been isolating and following all the rules, or have they been outside unmasked or, not following the guidelines? It'll make a difference whether or not you're going to give them that hug.
Yes.
So another question about what really matters to our viewers. Can I go to the beach?
So when you're talking about safety and areas where you're going to go to, the beach is probably one of the safer places because we have to think about how is this disease transmitted. You have to have a certain what's called viral load, meaning a certain exposure to the virus for a certain time period and a certain amount of virus. So in an area where there's a lot of wind and a lot of space where the virus is dispersed, you're less likely to have prolonged exposure and a high viral load exposure. You still have to practice social distancing. There's not a lot of masks on the beach, so you have to use caution. So you use your judgment, but the beach is probably one of the safer places to go.
Well, that's good. I think people will be excited to hear that.
Yeah, and get your mask suntan.
Yes.
So once again, I had commented before that it takes a village to really manage older adults, particularly those of a very advanced age with multiple medical problems. So the Maida Institute actually epitomizes that. We use an interdisciplinary approach towards taking care of complex seniors, and we are very lucky and blessed to have 3 fellowship-trained geriatricians, because there's not a lot of us out there, particularly in New Jersey. We have 2 geriatric nurse practitioners. They're also specialty trained and actually trained largely under us. So they join our group. We have a geriatric psychiatrist that actually offers electroconvulsive therapy to seniors if they need it. That's not a lot of geropsychiatrists available to manage complex psychiatric and behavioral problems in older adults. And we have our own social worker who also provides counseling as well as assisting you with access to different resources. We have a very extensive involvement with pharmacy. The Rutgers Pharmacy School practices and learns out of St. Barnabas. We work closely with them. We have our own laboratory services in the practice and support groups, which Dr. Grover leads one of our Alzheimer's and related dementia groups with our social worker, Kathy Ligori. And then we do provide additional services in the practice when it's appropriate to keep you out of the hospital, because we really do the best we can to keep you home, independent, with good quality of life, keep you out of the hospital. And that may include offering intravenous fluids and maybe even IV antibiotics in the office. Mm-hmm. So once again, the interdisciplinary approach towards managing older adults is key. And the ambulatory care center provides a lot of different resources: radiology, audiology, nutrition services. They have a physical and occupational therapy service, which is open and practicing. So they have an exceptional service, and we have a retail pharmacy right in the building. Once again, commenting on, we have house call program for homebound seniors, and we do visit you at assisted living if that is appropriate. Provide inpatient care. Telehealth is important. We continue to do that. And the transitioning you from hospital to home, hospital to help with transitioning to rehab and to home and to different areas of care.
I think it's really important for us to review that, to know what kinds of services are available when we talk about COVID, when we talk about other illness. To have these kinds of links to the community and these links to other places where patients can receive care and the services in the office are incredibly helpful. I want to take a minute for a thank you message from James Maida, and then we'll close out the seminar. We have a little message that he sent in.
Good evening. This is James Maida. On behalf of my wife Sharon and the entire Maida family, we'd like to thank you for participating in this inaugural event for the Maida Geriatric Institute at St. Barnabas Medical Center. We are so pleased to welcome this institute at St. Barnabas as a second member of the growing family of the Maida Geriatric Institutes based here in New Jersey. We are so thankful for the commitment by the RWJBarnabas system to comprehensive geriatric care in New Jersey, and we also look forward to our third institute opening soon in Hamilton, New Jersey. It is important to know that comprehensive geriatric care does more than just office-based care. It reaches into the surrounding community and brings people together. Education is a critical part of geriatric medicine, and tonight's webinar is a perfect way to officially open our new site. Thanks again for joining us this evening, and be well.
Thank you for that. So to close out our session today, there are a lot of questions, and I'm sure that there are a lot of things brewing now, even that people didn't think to send in. So we encourage you to engage your care providers, your primary care providers in this discussion, answering questions for you when circumstances come up that are individualized for you. We encourage you to call us. We're happy to meet with you and go over your questions, COVID or otherwise, as well. We thank you so much for participating tonight. Everyone who participated will get electronically a copy of this presentation sent to their email, the email that they registered by tomorrow. So we hope that this was helpful. We are thanking you again all for participating tonight. Be safe and be well.